Good evening and welcome to our COVID-19 update, a special edition on Channels Television on the coronavirus pandemic. I am Ladi Akredoluale. Here are the highlights. The National Center for Disease Control opens more testing centers. Federal government appeals to Nigerians to comply with stay-at-home directives. And crisis in the United States as New York medical equipment run out, just as Queen Elizabeth is to address the British people on Sunday. We begin tonight with what is, in fact, cheery news because earlier in the day, 4 patients were released by the Lagos State government after they were cured of the COVID-19 virus. This brings the total number of persons discharged to 23 in the state. However, 6 new cases were also reported in Osun State, bringing the total number of confirmed cases at this time to 190. A state-by-state breakdown of the cases show that Lagos still has 98 cases. The FCT Abuja has 38 cases, Osun 20, Oyo has 8 cases, Akwa Ibom 5, and there are 4 each in Edo, Ogun, and Kaduna states. Bauchi has 3, while Ekiti and Enugu have 2 cases, and Rivers, Benue are still on 1 case each. And as getting tested for COVID-19 to confirm their status seems to be the worry of many during this period, the National Center for Disease Control is appealing to Nigerians to be patient as the agency improves its testing capacities. The Director General of the NCDC, Dr. Chikwe Ihekwazu, says more testing centers will be added to the 8 currently in use. He also says efforts are being made to ensure testing is done safely.
Getting more people tested is something that is being talked about globally, and you would all have been following this conversation. This is exactly what we're trying to do too, improve our capacity to test, but we must do so safely, and we must make sure that in the effort to do it quickly, we maintain the due diligence and make sure that every test that we provide to every Nigerian, when it's negative, it's negative. When it's positive, it's positive. So as much as speed is important, safety is also important. And we have to find the balance between these two. Currently, we have added 1 more lab this morning over the last few days, so we now have 8. The reason is that now 3 labs working independently in Lagos. The Lagos University Teaching Hospital, which you knew about already, the Nigerian Institute for Medical Research, and now the Biosecurity Center in Lagos that used to work with Luth in collaboration have now completely separated. So we have now 3 labs working independently in Lagos, so we now have a total of 8. Like I said yesterday, Ibadan and Abakaliki have recently been activated. Today, we're activating a 2nd lab in Abuja, the Defense Reference Lab, to support not only the armed forces, but everyone around that area, their families, and everyone else that can access that. And we will work with them to scale that testing. The next town that we'll be going to will be Kano. So between Sunday and Monday, we hope to activate Kano and from there start a series of labs in the northern part of Nigeria to make sure everyone has access to the lab closest to his or her location. In addition to all of this, we have some exciting proposals that we're working through with the private sector. The private sector has really come on board to support us in doing this. Not just the private sector, some other public sector organizations that have private sector affiliations, the Nigerian Sovereign Investment Fund Authority, Nigerian Sovereign Investment Authority, is also working with us on a very interesting proposal to increase laboratory testing capacity in 3 locations in Nigeria. So there's a lot of work happening in the background to increase our testing capacity. But we need patience. We need the patience of Nigerians to walk through this in order to do it safely.
The Director General of the Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu. Meanwhile, the Minister of Health, Dr. Osage Hanere, today also emphasized the need for everyone to take the call for social distancing serious, as there are indications of community transmission of COVID-19, and this means more cases should be expected. Dr. Hanere therefore asked all states to speed up efforts in curbing the spread.
This is in view of the looming global shortages of medical supplies for.
So thanks for those very good questions. Firstly,
is also the chairman of the PTF.
If all the social distancing and other measures are adhered to, the incidence of positive cases can be controlled. We have tested nearly 3,000 samples so far, and we're working hard to scale up our capacity in a targeted approach. Coronavirus Treatment Center Accreditation Committee was inaugurated yesterday by the Honourable Minister of State for Health and has begun developing an accreditation checklist as well as a protocol for management of isolation centers. We are compiling a list of trained workers in the health sector to man the centers as they become operational. Directors of the Federal Ministry of Health had discussions with the Federal Ministry of Industry, Trade and Investment, and the Manufacturers Association of Nigeria to explore potentials for local production of medical consumables such as face masks, gloves, sanitizers, and even equipment like ventilators. This is in view of the looming global shortages of medical supplies for response due to high demand by all countries. Clinical trials and other processes are ongoing to validate various therapeutics for COVID-19 treatment. I have been notified of gifts of medical supplies from China, courtesy of a group of Chinese companies working here in Nigeria. A special cargo aircraft shall leave Nigeria in a few days to collect the items, which include commodities, personal protective equipment, and ventilators. Of great interest is that an 18-man team of Chinese medical experts, including doctors, nurses, and public health advisors, shall come along with the flight to assist us.
Minister of Health, Dr. Osage Hanere. And from there, we go to our studios in Abuja, where I'm joined by our correspondent, Kayla Megwa. Good evening, Kayla. What can you, of course, Kayla joins us via virtual reality. What can you tell us about the situation in Abuja today?
Evening, Mr. Ladi. Well, the compliance level in the nation's capital has dropped drastically in the last few days. Now, markets have been opened in the satellite towns between 10 a.m. and 2 p.m. So you're supposed to be indoors before 10. If you need to go get anything in the market, you buy it before 2 p.m. and then you go back home. People are not adhering to this, Mr. Ladi. Drove around town this afternoon and noticed that many people use the excuse of going to the market to come outside, and then when it's 2 p.m., they don't go back home. They're still roaming around. In fact, for many people, they think this curfew may be from 6 a.m. to 6 p.m. because, interestingly, after 6 p.m., you start to see a lot of people driving around. The police and security operatives have been doing what they can. They stop people, they ask you, and they're trying not to be forceful, you know, getting to ask them, why are you still doing outside? You're not supposed to be outside. But people come up with one reason or the other. I spoke with a few people today, and I think many people believe that this is a holiday. It's not a holiday. It's a quarantine. It's time for you to stay indoors. You're supposed to self-isolate at this time. Stay indoors so you do not get infected or infect other people. It's not an opportunity for people to hang out or go see their friends or hang around the corners in the area. No, this is the time for the people who have the disease and are not presenting any symptoms. This is time for those symptoms to show. That's the reason for this. And I think that information needs to be put out there for residents in the nation's capital. There's also the question of power supply. A lot of people in the nation's capital have been complaining bitterly about power supply. A lot of the things that they bought to keep for this period of 14 days. A lot of those foods are spoiling. People are throwing things out. There's a lot of conversations on Twitter about this, especially in places like Dawaki, in Kubwa, Arab Road, especially in that Kubwa axis, Lugbe, Federal Housing. They have all these, and many other parts of the FCT. It's not just these places. A lot of the places in the FCT are having poor power supply, and that is affecting all the things that they bought so that they can take care of themselves within the period of this quarantine. So those are some of the things that we're seeing here. But most importantly is the fact that the adherence to the stay-at-home order is not being followed, and I think more education needs to be done about that. There's also the question of people who are collecting stimulus packages. A few people who I spoke to today were wondering why they were not involved in receiving the stimulus packages. What were the modalities used for the sharing of these stimulus packages? So a lot of education from the National Orientation Agency has to be done, and the humanitarian ministry as well. A lot of education needs to be put out there so people can understand what is going on. The reason why there's so much speculation and so much fake news on the situation is because the information that is needed, some of it comes out, yes, of course, during the briefings, but there are many questions that people have, and maybe as the days go by, we'll have more answers to those questions so that the speculations in town can reduce, Mr. Ladi.
Now, did you at any point, Kayla, hear that, because, I mean, from tomorrow, Saturday and Sunday are weekend days, that the situation is likely to remain the same or even get worse, in the sense that being a weekend, enforcement is likely to relax. These are the expectations that some of those that have been spoken to in the commercial capital express, that the enforcement will be relaxed, it's weekend, and therefore people will go out. Did you get any sense that that is also the situation in the FCT, or is it particularly going to be different as we move into the weekend?
To be quite honest, if the education that is needed for people to understand why they need to stay at home is not provided, there is I don't want to make it look like there's no information. There is information, but people need to understand maybe that we're still back to where we were in the beginning, where we said people probably do not understand the magnitude of the problem and how bad it can actually get. So it's a little lax. I think the task team, that's what they're calling themselves, that's supposed to enforce this order, are being soft about it, and I understand why. It's a time of a pandemic. They probably don't want to use force. That's why they've not called themselves a task force. They're trying to see if people can just do the right thing. So the call is actually to people to do what's right. It could actually get worse. The compliance order, to your question, it's possible that in the weekends or in the days to come, people are becoming more and more lax. I saw so many people on the street today after 2 p.m. and I purposely waited till 2 p.m. to see if people complied, because if you went to the market to get things between 10 a.m. and 2 p.m., you should be home by 2 p.m. or towards 3 o'clock, to continue with the stay-at-home order. But many people took that opportunity to hang out. Some people use the mornings to work out and whatnot, but the idea is to stay at home so that those who have symptoms can show, and then treatment and containment can be done. I spoke to someone today, Mr. Ladi, who was worried about this opening of the markets between 10 a.m. and 2 p.m. Now, the gentleman I spoke to said he understands why the markets were allowed to be open and, for those periods. I remember these are just markets in the suburbs, not the markets in the city center. So he says he understands why those markets need to be open, but doesn't it defeat the need for self-isolation? Doesn't that defeat the need to stay at home? So these are some of the questions that we're seeing. There's also the fact that Easter is around the corner, and that's a particular period that I've been a bit worried about. Thankfully, many churches have been adhering to the stay-at-home order. In fact, many churches, when you go, they give you a hand sanitizer at the gate and turn you back. But, the Easter season is out. We don't know if people are going to be going outside. It'll be interesting to watch, but hopefully the right thing is done by people. That way we safeguard ourselves and really fight this thing and flatten the curve, Mr. Ladi.
All right, thank you so much, Kayla, for that extensive update. We hope please keep an eye on things, and please, more importantly, stay safe. Our correspondent, Kayla McGraw, joining us virtual reality from our studios in Abuja. Now, from Abuja, we go to neighboring Niger State, where Emperor Simon has an update on the situation there. Emperor?
It's been weeks of curfew in Niger State as part of measures taken by the state government to curb the spread of COVID-19. But in recent time, what we've seen is dismal compliance to that directive. For instance, what you see behind me is the traffic caused by motorists, motorcyclists, and tricyclists who are already out and operating. Also, you can see from my far right, traders who are already out and displaying their goods for sale. Obviously, the compliance level to the curfew is still a major case, a major issue of concern. Now, what do the people think about the way the government is going in addressing the issue of COVID-19 in Niger State? I chatted with a few of them, and this is what they have to say.
The government has doing its possible best in terms of making people to be aware that when they came out from at least 10 to at least 2 hours is there, 6 in the morning to 10, it's enough for you to get a little things that you're going to feed your family with.
We expect to see the government committing itself to the measures that it has already rolled out, and that we also see will encourage people to comply. That's the update for now. From Mina, Emperor Simon.
Thank you very much, Emperor, for that update. And joining me in the studios at this point to discuss this is Dr. Jamiu Ganiu, who is a public health physician. Dr. Ganiu, thank you so much for joining us. Are you a bit worried? The reports we have from both the Federal Capital Territory and Mina in Niger State both have one thing in common: low level of compliance with this social distancing.
Yes.
Yet the minister says we should prepare ourselves because of that for some level of community transmission and therefore more cases.
Yes.
Are you worried? Yeah.
Yes, I'm worried.
Go on, please.
Okay, I'm worried in the sense that what they just reported now,
Yeah.
in Lagos, there is a bit of difference, some level of compliance.
Okay.
But I could still see, even this evening as I was coming, I saw a bus loading from Lagos to Ibadan. Even this afternoon, yes.
From Lagos to Ibadan.
Yes, you were leaving Lagos as I was coming to this studio this night. And even this afternoon, I saw some commercial vehicle loading passengers. So I was a bit worried. My concern is that this is a great opportunity, a window of opportunity for us, which we must not miss, to make sure that we get those that are infected and get them and link them to care. And even before world go, I wouldn't want to call this a lockdown.
Right.
I would rather call it stay at home approach, in the sense that you are saying a stay at home, whereas neighboring states are busy doing their normal business. So there is that possibility of people. I remember Ogun State and Lagos ought to have been locked down at the same time.
Right.
But the Ogun State has to suspend theirs for like 5 days. This started today. There is that possibility of some people to have of them moving to Ogun State. We say this is a virus that even whether you are symptomatic or not, you can still be transmitting such transmitted infection. Is that likely that some people have moved to Ogun State? And at the end of 2 weeks, when maybe Ogun State will still be on lockdown, some people will move back to what? To Lagos. So that would be like a wasteful effort. But this is a big opportunity for us to do that. And I think this is the right time. There is ongoing review, actually, with regards to this. Actually, in Lagos, we'll be able, there is some level of compliance, but we must do more. For instance, the toll. I want to make comment on that toll number. There is a challenge with the toll number.
Before you go into that,
Yes.
let's take a quick break. When we
Okay.
come back, you make that comment. And then I also wanted to talk about this migration of people, because it's not only Lagos, people are migrating everywhere. When this state closes its borders, people move here and so on. We'll come back after the break and talk about that.
thank you.
Please stay with us. Thanks for staying tuned. Welcome back to our COVID-19 special studios. Dr. Ganiu, Jamiu Ganiu is still with us in the studios. And before we took the break, you were about to talk about patient management and about the helplines that have been put in place for people to call in if they feel or if they have information and so on. What was it you were going to say?
So I was trying to make it give a scenario. Let's say, for instance, 10 people call at the same time in a particular number. What do you think? You will only be able to respond to one person.
Right.
So when the other people keep on calling,
And you're still on the line with that person.
What do you think will happen? They get frustrated. And then what will happen? They will resort to unprofessional ways. Or we are talking about using chloroquine, using ginger. That's what they will go say, there is no any help for me. So they will resort to all sorts of practices which is against the standard management. So in a nutshell, I think instead of us asking people to call, I would recommend that we ask them to send text messages to those toll number, indicating their names, if possible their age, their addresses, their number, so that subsequently when they are reviewing those SMS, they can be able to link up with the case investigation team so that they can follow up with that process. So I'm just appealing at this moment, instead of just putting toll number, we can send SMS through the toll number. I think it will encourage more people to want to key into the toll because people are getting frustrated. And you all know the system, the GSM system in the country, issue of jam, log jam, and so on. So I'm advising, instead of calling, they can just send SMS so that they can, on a daily basis, review the SMS and make contact with those likely suspected
What's
cases.
our situation now in terms of patient care management?
Well, another thing also, currently,
Yes.
in IDH is for about 90-something cases.
That's the infectious diseases hospital.
Yes. And one thing I'm happy about is that 60% of those cases are mild to moderate. So I will advise that, is it possible, luckily enough, we're having another isolation center in Onikon, which was supported by GT Bank. I will advise that we can decide to be, admitting the mild to moderate case at the Onikon, then the severe ones, if we're able to eventually get them, should be taken to IDH. That will even reduce some pressure on IDH so that those ones that are minor or milder cases can be managed at GT. They don't need ventilator, they don't need the old sophisticated equipment. It's just simple supportive management and so on. And likely, many of them are recovering. So through that, we can have opportunity for other people to come in just in case.
Now, thank you, Doc. We'll take a break from our discussion with Dr. Jamiu Ganiu and go now to Bauchi in Bauchi State, where Hajara Aliu earlier on sent in this update.
In Bauchi State, is business as usual, despite 3 confirmed cases of the coronavirus. Yesterday, the Bauchi State government reversed the total lockdown order. I'm here with one of the residents. Let me find out from him how he feels about the reversal. How did the news meet you?
It was actually what we expected, because we expected that the government would be reasonable, because we live in a town where people have to come out every day, hustle for what they eat, go back home. Our income level around here is not the one that can allow you to stock, even though some people can do that, but the majority cannot. So we actually are happy. And for the issue of the coronavirus, there is so much awareness that people are trying as much as possible to do the little they can do. Because around where we stay and work, we have to wash our hands regularly, the social distancing. The awareness is such that it's surprising how people around are able to pick up.
We understand that the Bauchi State governor has been in self-isolation for about 10 days now. And at the weekend, his sample will be taken for another testing to reconfirm his status. If he tests negative, any moment from next week, he may resume usual duties. From Bauchi State, Hajira Aliu.
Thank you very much, Hajara. Before we go to Bayelsa State, Yenagoa precisely, which is our next port of call, this just in, the Ministry of Foreign Affairs in Nigeria has directed all its missions abroad to compile a list of Nigerians willing to come back home. The chairman of the Nigerians in Diaspora Commission, Abike Dabiri-Erowa, says the directive is sequel to requests by some Nigerians stranded abroad in the wake of the COVID-19 pandemic. Mrs. Dabiri-Erowa adds that the ministry has instructed that the financial implications will be borne by the prospective evacuees who will be compulsorily quarantined when they return. She also says interested citizens should inform the embassy in their country of residence about their intention to return home. And now let's go to Yenagua in Bayelsa State, where Oidobra Timmy Wood is standing by.
Good evening. As you know, Bayelsa State is one of the states in the nation that is yet to have an index case regarding the COVID-19 virus. Notwithstanding, the state government is not resting on its hours as it's putting appropriate measures in place to ensure that its citizens are protected. Aside the earlier announced partial closure of the border into Bayelsa State, the government has also announced that it is beginning a food distribution method to help rural dwellers in these trying times. Now, we haven't seen any direct beneficiary of this food distribution, but we believe as the process continues, we will see those that would directly benefit from it. Yesterday, the governor announced a partial close down of all markets in the state. He permitted only those trading in food items and medical supplies. Now, members of the task force went out today to ensure full compliance. Other than those trading at the market, those that own private stores in Bayelsa State are still fully operational. Now, like you can notice, behind me, cars are moving, so there is no lockdown in Bayelsa State yet. People are moving freely. Businesses are still open. Now, when it has to do with enlightenment regarding how to ensure that you do not contact the coronavirus, now that may be a little bit low, as anybody that moves around in Bayelsa State with a face mask and with gloves would definitely earn a glance from people. People would look at you like, COVID-19 is not yet in Bayelsa State. And that's because there is no recognized index case in Bayelsa State. But people are still sharing awareness, educating people, telling them if you do not have any essential service to provide, then please stay indoors. From Yenagua in Bayelsa State, Dobra Simiwood.
Oidobra, thank you so much reporting there from Yenagua in Bayelsa State. I continue in the studios here with Dr. Jami Ugeniu. Dr. Ugeniu, what do you make of the Ministry of Foreign Affairs statement that those willing to come back home should indicate they will bear the cost, and when they get back, they should prepare themselves for quarantine?
Yes, well, the only aspect I want to talk about is that I just believe we should not, I just believe that whenever they will come back, please, it should not be like the usual quarantine that was implemented previously, whereby people go to their houses, you'll be calling them. I want to tell you that we made some mistake implementing that measure, because at the end of the day, we could not be able to get some link or some contacts.
Some were said to have given fake
addresses.
Fake
so if
so
I would advise that if you can make a provision for a hotel or something where all of them will be for the next 14 days, they can decide to bear the cost of staying in that hotel. They may train the hotel people to a kind of, they will train them on how to manage them, but they should not allow them. My advice or suggestion is that people like that, from past experience, should not be allowed to go back to their various houses. They should be, kept in a safe place for at least 14 days. And that really worked out. I don't know whether you remember the case of Osun State,
yes,
where about 5 buses were coming. Had even those people were allowed to get to their home, it would have been a disaster. So they were quarantined in a secondary school in Ejigbo. And at the end, about 14 or 15 of them, now out of 127 persons now have confirmed positive. I just pray we are going to do the same to whoever is coming back. We should not allow any of them to go back to their various houses. We have to make provision for them to stay in a particular place for the period of incubation,
the quarantine period
which is 14 days. That's my point.
Now, before we took the break, we're talking about migration.
Yes.
And then the seeming lack of coordination amongst the states.
Yes.
On Sunday, the president announced that Lagos, Ogun, and FCT.
Yes.
Then later on, we heard that Ogun had requested the president for his special dispensation.
Yeah, we started today.
And so that they are going to start today.
Yes.
In the meantime, I remember seeing during the course of this week, the governor of Kano turning back some people who were coming from Abuja,
yes,
which had been placed under lockdown. Now, this movement,
yes,
does it not defeat the total purpose of the lockdown?
Well, that's what I'm trying to say. I would have expected that we have a kind of lockdown since Lagos State is having the highest, I would have expected that all states surrounding Lagos State should have been included at the same time in the lockdown to prevent entry and movement of people. Because we don't want to have a repeat of what happened in Italy at the initial time in Lombardy, when some community, close to about 50,000 population, were quarantined. And then some people sneak out to those places where there was no lockdown. They ended up, transmitting contacting other people in other places where they went and leaving their elderly people with the same virus. I think I would have expected we have a block lockdown. Maybe since Lagos having the highest, we can decide to have maybe the entire Southwest, whereby we have, if it is going to be 2 weeks or 3 weeks, no movement in and out. They said the essential service personnel.
Right.
That will have make the whole measure more effective. Yes.
All right. Now, Dr. Jamiu Ganiu, please, just a moment. Let's take our global update at this time and the news from around the world. That is a shortage of several hundred ventilators in New York City. The epicenter of the outbreak in the U.S. has prompted the governor to say that he will order the machines be taken from various parts of the state and given to harder hit areas. According to Andrew Cuomo, the state has around 6 days left of equipment at the current usage rate. Meanwhile, over in Britain, Queen Elizabeth is to address the nation on Sunday as the death toll in the country continues to rise. Indeed, the global update. Let's move over to Toronto in Canada, where a consultant radiologist and chief executive officer of ProRad Health Centers, Dr. Tayo Denton, joins us to look at the COVID-19 situation in that country and what, if any, lessons Nigeria can learn from the country's response efforts. Good evening, Dr. Denton. Thank you so much for joining us.
Good evening. Thank you for having me.
Now, you have been in self-isolation for almost 2 weeks yourself after returning from a trip outside Canada. How strict are the isolation guidelines in Canada and how are they enforced?
Well, there's actually legislation behind it. I came back from Nigeria, and there is legislation which basically says that anytime any traveler coming into Canada has to self-isolate for 2 days. And that's what, because otherwise detained. I do so in a way it is military as a means country of flattening the curve, which is ensuring there are not many cases overwhelm our essence.
Now, I do apologize. We seem to be having some problems with the audio of this Skype from Toronto. Now, Dr. Denton, if you can still hear me, and we hope that this gets better for this question. We also talk about the home delivery system, the health delivery system, that is. What is government doing to cushion the effects of some of the gaps in that system, given what is going on now?
Well, things like border closures and social distancing. So most of the country is actually on lockdown. For essential services, most people are staying at home and they're keeping to that stay at home. I would, however, notice that it is something that we are able to do as a so-called first world country. The other thing is obviously sanitizing, hand hygiene, and testing. But testing it's a more liberal testing that I understand goes on in some places, but you still need symptomatic patients. You still need to have symptoms, healthcare workers, people in hospital, or recent travelers.
Now, if you're to take a look at it, I'm sure, as you said, you come back from Nigeria. The big news that came out of Canada with respect to this was that the Prime Minister's wife had contacted COVID and had gone to the UK and had been back and so on. But at the base level, what is it like? We're hearing of shortages in the UK and in the US. Is it the same or is it very different in Canada?
Right now, I'm in contact with my colleagues in the hospital who don't have shortages. We seem to be faring better than our neighbors. So we have protocols. People are keeping to those protocols. And it's whatever we have is being used. We're still aware that worse is still to come, that it's going to get worse, but we still are able, we have the same problems as US, UK, Italy, whatever.
Finally, Dr. Denton, what would you advise? I mean, you've been here in Nigeria and you're back in Canada Now, what would you advise, given your experience, that we should do more in this, in respect of our own efforts in Nigeria to tackle COVID-19?
I think it's important not to feel that we have to export what Canada is doing wholesale into Nigeria and realize that we need a solution which is not only effective, it's humane. And part of it was to make sure that travelers come in actually get tracked and tested by whichever means. Now we have able to track by cell phones or maybe your credit cards, but testing is an important thing. And maybe to decentralize that testing. My understanding is the testing is entirely by the NCDC, and maybe it's to decentralize it a bit more so that more people can get tested. Because the only way you know is not just by having those people who contact NCDC, is to be able to have people who go into the usual hospitals and clinics to have testing available to them without having to go through the process of maybe going to a website. How many people have computers that they can actually go and notify NCDC that they, and the symptoms are not just fever, cough, and difficulty breathing. There are also other symptoms which people need to be aware of so that we can catch this early. I think for us, it is catching it early enough that it doesn't become a tragedy.
Now, sorry, I said I had asked the last question, but I wanted you to expatiate a little on some of those other symptoms, because for most people, they've only heard of the three that you mentioned.
Yes, there are actually a wide range of symptoms. You have GI symptoms, you have diarrhea, you can also have loss of taste and smell, very important ones. And there are all kinds of other things that are coming up that are associated with COVID. So we have to expand our net of people who are symptomatic and not just insist on all three. And there are people who will come in not necessarily with a fever, not necessarily with a cough or with difficulty breathing, but they will have, and I have had colleagues who have had experience of this, where they came in with just diarrhea. And it turned out they were COVID.
All right, thank you very much, Dr. Denton. It's been a pleasure having you with us. Dr. Tayo Denton is a consultant radiologist and chief executive of ProRad Health Centers. As you've heard, she herself is in isolation in Toronto, Canada. She joined us via Skype. Thank you very much. And we'll take a break at this point. We'll be back with our closing moments. Thanks for staying tuned. Welcome back to our program here, the 9 p.m. segment. And I'm still in the studios here with Dr. Jamiu Ganiu, who is a public health physician. Now, Dr. Jamiu, before we took the various inputs from across the country and then across the world, we talked about patient management, and we also talked about how to locate some of the people who had come in and had given maybe not altogether complete or correct information and are therefore being found difficult to look for or locate now. What is to be done about that?
Okay, currently, following a review, we now feel we need it. The initial report have been passive. We now decided, okay, let's make this surveillance active. So we are now developing a kind of plan so that we will be the one looking for them in the community. And we will be doing that in collaboration with the opinion leaders in the community. We'll be also going to facilitate both public and private to review some of the records in the last 2 weeks or 1 month to see, based on our case definition, anywhere that means that we try to see how we can triage. Those one we feel is a suspect, we can see how we can trace them and call, ask, demand for testing, and if they are positive, we now lead them to care. So we are using the community people like the CDA chairman and so on. We will give them some orientation so that they can recognize people that have such kind of condition in the community with the kind of community collaboration. This time around, we want to involve the community. All along, it has been a passive kind of a thing. But we now feel we need to involve the community, go to a facility, review their records, and see how we can, maybe those people that have been having symptoms which they did not know that it's actually a patient, we see how we can, through the hospital, locate them, try to test them, and see if any of them is a suspect. We link them to care, then we can continue. We link up with our contact tracing group. So that's the current thing we are trying to do now. It is called enhanced surveillance.
Well, I think we have just about a minute and a half left.
Yeah.
Now, I want to still touch on this lack of coordination between the states, because we were talking about it earlier, about people moving around. Lagos State is shut down, so we go to Ogun. When Ogun shuts down, we then move on to Osun, and then move on to Ondo. When Ondo closes, we go to Kwara, and so on. And there are people who are doing that, possibly defeating the entire purpose of lockdown.
Exactly.
How do we tackle that? Is it by a national lockdown?
National lockdown.
But people are already complaining that at the level of the states, they are not providing palliatives, there's no light, and so on, and yet you expect people to stay at home, they don't have any money.
I agree, but what I'm trying to say is that I think proper education, one of your colleagues mentioned it, if people understand the magnitude of the problem, they will key into whatever we are doing. Because some people even believe it does not even exist. Some people even believe government is just cooking figures. So they need to be educated. That's why I don't know where is our National Orientation Agency. They play a key role during Ebola. But I've not been hearing about them. This time around, it's not on media. It's not on... they need to go to the community, either using a microphone or also a megaphone, so that they enlighten, they let people appreciate the magnitude of the problem. I think by so doing, they will be able to sacrifice one or 2 weeks so that we all have this thing addressed once and for all. Without that, my brother... what?
Well, I mean, we're being told to prepare already. Yeah, I mean, those who probably know a bit more we're being told to prepare against possible spike in some of those cases. I want to thank Dr. Jeremy Ugeniu. Thank you so much for being with us on the program today. As we leave you on this segment tonight, please remember you can send us a picture or a short video on how you are observing this sit at home. The various handles that you can reach us on are there on your screen. Our website, of course, has the latest information on the COVID-19 pandemic. You can always go there and check. But on behalf of the crew who have worked all through this time, my name is Ladi Akeredolale. Remember, we're back on our studios reopen on Monday at noon, and then we'll have updates at 6 and 9. But all through the weekend, we'll be on this matter as it happens. Good evening.